Welcome to the workshop on using data to design reentry and reinvestment initiatives. I'm Nancy Lavine with the Urban Institute. I'm here with Marshall Clement, who's the project director over the Justice Reinvestment Initiative at the Council of State Governments. And we're here today to convince you that data matters in a lot of different ways, and not just when it comes to demonstrating to the federal government that you are justified in getting continuation funding, although I suspect that's why some of you are here today. So I'm going to turn it over to Marshall, and we both have pretty lengthy presentations, but we want to welcome you to interrupt and ask us any clarifying questions you may have along the way, and then we should have plenty of time to take questions at the end as well.
Good morning, everyone. Feel free to come up, and there's plenty of seats up front. We don't have handouts, so again, bigger screen if you come up front, easier to see. There'll be handouts on the website, and we'll be emailing out once it's posted, so you can download it there and get all the information. So I'm going to try to talk fairly briefly and get to the heart of the matter, but first I want to talk briefly about why I use data and the importance of it, is kind of reiterating some of the themes that I think all hit us hard in terms of Senator Brownback's comments and other congressional leaders yesterday about just the importance of demonstrating the impact that your efforts have. Second, I want to talk about key lessons we've learned from our work in justice reinvestment in terms of designing initiatives that have an impact not only on recidivism and public safety, but on prison and jail populations, which is where you're going to get your most immediate and real savings from these efforts. And then finally end with just talking a little bit about what justice reinvestment looks like at the state level, and use New Hampshire as a case study, which is the state we've most recently been applying that approach and seeing some results. So the case for recidivism reduction strategies couldn't be stronger, right? Spending on corrections is up everywhere over the last 5-10 years. In Michigan, which we're looking at here, spending has gone up nearly 60% over the last decade, to the point where 1 in every 3 state employees works for the Department of Corrections. And we're seeing similar rates of increase and similar high rates of state employees working for departments of corrections across the country. One reason why we're seeing spending and prison populations go up is because recidivism rates have climbed. You all know that the number of people released from prison and jail has been increasing as prison populations have increased over the last 10 years. But even the share of those released each year that are failing and returning to prison for one or more reasons has increased. This is in New Hampshire. The recidivism rate just in between 2003 and 2005, looking at 3-year release cohorts, has gone from 40% coming back to prison over that time period to 51%. We're seeing similar rates of increase in recidivism in other states as well. Obviously, as we all know, state spending and state budgets are in a world of hurt, even especially considering where we were back in the earlier part of the last decade. $180 billion shortfall projected for the next fiscal year. So we know that yet, despite the need for recidivism reduction strategies, spending on correctional programs is going to be declining and already has declined substantially. A report from State Line last week had Director Justin Jones, who I believe is here, mentioning that they have no drug treatment in their medium security or higher facilities, and they've eliminated all sex offender treatment, even though it's mandated by statute. When you get to the point of not even providing those programs that are mandated by statute, like sex offender treatment programs, you know that there are few and far between in terms of programs. Last year, before a lot of the budget cuts happened that we're seeing now, VERA Institute of Justice released a report that 19 states had already cut or declined or canceled contracts for programming both inside and outside. So in order to survive in this climate, obviously all of our initiatives need to be data-driven to ensure that they have an impact on prison and jail populations. And unfortunately, policymakers have good reason to be skeptical of investments in this area. In Ohio, policymakers spend each year roughly $100 million on residential halfway house programs. It's a lot of money, right? $100 million a year in general spending, general fund revenue. And because it makes such a big investment, policymakers there have employed researchers from the University of Cincinnati, Dr. Ed Latessa and others, to evaluate the impact of that investment of $100 million. And what they find when they looked at matched samples, well, half the programs they funded increased recidivism. One program on the order of 50% increase in recidivism, and half the programs decreased recidivism. The problem is that net impact of this investment is zero, right? Some people definitely got better. Public safety was improved in certain parts of the state for those organs, but for a state policymaker looking at the state budget and this overall investment, this is a wash, right? So the good news is that programs can reduce recidivism. We see 50% reductions in some of these programs, 20% in others. The problem is, unless you're data-driven, unless you're targeting, unless you're investing in high-quality programs, you can also end up funding programs that actually make things worse in terms of public safety and in terms of spending.
Were they similar programs?
All,
They were just like anybody and everybody just opened the house and called themselves something?
they're all state-funded. They all have, the question was, are they all similar programs? They're all halfway houses. The methods and models of programming they deploy through that residential program are different, and that's one of the reasons why we see this variation. So what lessons have we learned from Ohio and other states' efforts to make that not be the case for the Second Chance program, right? We don't want half the grantees to increase recidivism, half to decrease, and the federal government to say it's been a wash. So 4 lessons. First, we often talk and focus on people released from prison when we talk about reentry programs, but actually it's, I think, more important to talk about and analyze who's coming into prison when you're designing your initiatives. Second, to use risk assessment to narrow target population. How many of you were at the panel on risk assessment? All right, okay. So we won't talk about the details of risk assessments, but rather how to use them to make your program have the biggest impact. And then third, how to ensure that your approach has a solid research base and is of high quality. And finally, what kind of real-time tracking mechanisms can you put in place so you're not waiting for a 1-year follow-up, 3-year follow-up recidivism study to know whether or not you've had any impact. So in terms of analyzing who goes to prison, whether you're working at the Department of Corrections or you're a community-based program, looking at the Department of Corrections' annual reports or talking with their research department, most Department of Corrections should be able to give you this kind of breakdown of admission types for a given year. Let's take 2009. This is just fictitious numbers based on what we've seen in a lot of different states. But you want to look at those as parole revocations or parole failures, people who are on parole or post-release supervision who have failed, committed a new crime, or been revoked. Probation revocations, most often go to jail, but a good chunk of them are going to come to prison and might be a focus of your jail reentry program. And then new sentences. And obviously the focus you're going to want to look at is parole revocations if you're looking at prisoner reentry as your target population. And so you want to know, obviously, the number that are coming in each year. But then you also want to look at their average length of stay. And this is critically important. You want to know how long, on average, a parole revocation is going to end up in prison. And the importance of that is because while revocations represent still a significant portion of admissions, here about 50%, and that's true in most states, they represent a different share of the overall prison population. And so by taking the average length of stay and multiplying it by the admissions, you can understand the portion of your prison population, the actual annualized beds that are taken up by probation failures. The reason why that's important is because you can then apply the annual cost, which is any corrections administrator will tell you is a fictitious cost because the costs don't go up and down as you modulate the number of people in that way. But you want to identify the cost, basically, of failing to address the reentry problem, right? So by taking the annualized cost and multiplying it by that 3,000, you get 90 million. 90 million is what this fictitious state spends each year on reentry, right? The problem is they're spending it once the person's already failed. They've already been revoked. And so this is a critical messaging point for policymakers. The state's already spending 90 million on reentry failures. The question is, can you take any of that 90 million and front load it so you can actually reduce those that fail to increase public safety and to reduce overall costs? But that's the target. That's the amount of money. That's the pot of money you're trying to impact, right? By addressing the number that come in for parole revocations and addressing those that then translate into prison population. Next, you want to narrow this by geography, assuming you're working in a particular county or counties and not at the state level. You want to break down those revocations that come into prison, again, not those released, but those that come into prison by geography. One that's going to tell you where to focus your efforts just in terms of numbers, how many people are on parole, but also by taking the revocations each year and dividing that by the parole population in each county, you can come up with a revocation rate. So in this example, this is from New Hampshire, Hillsborough is the biggest county with 527 people on parole. It might make sense to focus there. But actually, they have one of the lowest revocation rates. Only 28% of people on parole in Hillsborough are revoked to prison each year. So your chance of getting much impact with an already low revocation rate is pretty low. Instead, it might make sense to focus on a particularly small county like Sullivan, where only 84 people are on supervision, but 74 of them were revoked to prison in last year. Your potential to have an impact and reduce that rate and reduce that number is huge, right? And a much smaller target population. If you were looking at releases, you wouldn't see this kind of data, right? You would just see the number of people coming back, serve them all, et cetera. Again, you want to focus on those that are coming back into the system, failing, and then using that information to figure out where you're going to target geographically. You want to look at reasons for revocation at the state level and in particular counties where you're focusing. Again, this is data that some Department of Corrections will have, some won't, but you can get at through sampling, through taking a set of cases for a period of a month or two and just doing some hand counts to get a sense of this. What we find in most states is that when we look at those failing on parole, about 41% are coming back to prison with a new sentence or a new criminal allegation or a new arrest, and about 59% have violated the conditions of supervision, right? They've tested positive for drugs, they've not shown up for appointments or other reasons. And when we look at the reasons for violating the conditions of supervision, in most states, when we actually get this data, we find that 75% of the time there's indication of drug use, and that's the primary reason we see people being revoked. And usually this is repeated drug use. This isn't just one positive, urine analysis. We also see failure to participate in programs and absconding as other reasons. But what this tells you is, in terms of, again, a data-driven approach, and you want to do this analysis if you can for your jurisdiction, but if you're going to reduce revocations, you're going to do it by primarily first reducing technical revocations. Is going to be the easiest and biggest pot of folks you're going to address. And within that group, drug use is the primary reason why parole agents are revoking people back to prison. And so the ability for you to reduce recidivism depends on your ability to work with parole agents and change how parole agents respond to drug use by parolees. Obviously, connecting people to treatment is the primary way you're going to try to prevent that from even happening, but then we're changing the response to folks once they are using drugs or test positive is also going to be a critical part of your strategy. So that's the first point in terms of looking at who's coming into prison instead of who's coming out. Second point is in terms of risk assessment. We know for any 100 people released from prison, and from talking to some of you, it sounds like most of the target populations for the demonstration grants are around 100 or so individuals. But for every 100 people released from prison, we know, as you know well, 40% or so will be reincarcerated within 3 years for a new crime or technical revocation, and about 60% will be quote-unquote successful. They're probably not successful by lots of our measures, right? They've been rearrested. They've committed crimes that haven't resulted in arrest. They've not been stable. But in terms of a state policymaker's view of this person, they haven't come back and taken up another prison bed, right? So the question is, if you're going to impact jail and prison populations, how can you get at that 40? How can you impact that 40? How do you know when you're addressing these 100 individuals which category they're going to fall into? We don't know, right? And this is the importance of risk assessment. Risk assessment can tell you with greater probability, they can define groups that have a higher probability of being reincarcerated than other groups, so you can target your efforts more effectively. The importance of risk assessment, which many of you know about, is this. We know that from research in Ohio, if we deploy a resource like a halfway house bed, which is pretty expensive, about $10,000 per offender, and we take a low-risk offender, according to a risk assessment, and we put them in that halfway house bed, we're going to increase their recidivism rate by about 3%. We're definitely not going to do anything to reduce their recidivism rate, and the research suggests strongly that if you take a low-risk offender and you put them in a resource like a halfway house or a program, you require them to report often to your parole agent, you're going to actually increase their risk assessment. You're going to make public safety worse. Okay? If you take a moderate risk offender, you're going to reduce recidivism, but only by about 6%. Now, 6% is not bad, but it's not much to write home about, and it's not going to make your program cost effective. It's impossible. If you focus on high-risk offenders, you get twice the impact. This research suggests about 14% reduction in recidivism. This is something to write home about, right? So let's simulate quickly for you how this plays out and the difference if you focused on everyone released from prison, regardless of risk, versus high risk. Say there's 100 people released from prison. We do a risk assessment. We are able to classify people into 30 are low risk, 40 are medium risk, and 30 are high risk to recidivate. We identify that the recidivism rate for each of those groups, if we do nothing, is 20% for that low risk group, 40% for that medium risk group, and 60% for that high risk group. Is everyone following this so far? All right. If we apply the intervention, using those percentages that I just showed you, the arrows, to those starting recidivism rates, we're going to, for the low risk group, we're going to take people from 6 people going back to prison to about 6 or 7 people going back to prison, right? No change or slight negative improvement, negative result. For medium risk folks, instead of 16 people going back, only 15 are going to go back. One person's outcome has been changed. For the high risk group, instead of 18 people going back, 15 people are going back. You might be asking yourself, wait a minute, 14% reduction in recidivism, that doesn't look like 14% reduction in recidivism. And the bad news I have to tell you is that the problem with, when we talk about a 14% reduction in recidivism, we're not talking about a 14 percentage point drop in the recidivism rate. We're talking about a percentage of a percentage, just to make things complicated. And so a 14% drop in 60 leaves you with 51%. So that means you're only really changing the outcomes for 3 people, even though you served 30. So how does this play out? Well, if you served 100 people, regardless of risk level, 3 to 4 fewer people will be reincarcerated. You served 100 people, 3 to 4 people didn't go back to prison as a result of that effort. If you served 100 high-risk individuals, 9 fewer people would be reincarcerated, right? It's 3 times bigger impact if you were just to focus on the high-risk individuals. So this is critically important, right? If you do not have risk assessment information on those people that are coming into your programs, you are likely not having an impact on recidivism that is anything that's going to be cost effective. And worst case scenario, you're tending to focus on low-risk offenders because they show up, they're easier to work with, they want your help. That's why they're low risk. The folks that are high risk aren't showing up, don't want your help, and that's why they're high risk. And that's why you need to focus on them. And that's why it's incredibly hard to do. If you don't have a risk assessment, stop and get one. And this isn't rocket science. Carl Wicklund went into the details and nuances of risk assessment, and there's a whole set of literature that's very confusing but important to read about that. But if you don't have a risk assessment, there are tools that you can employ at a very simplistic level just to get some cut. And something is better than nothing when it comes to risk assessment. That said, you do want to make sure that if you're using what the Department of Corrections tells you the risk of this person is, or some other means, that it's been validated in recent years. And I only raise this because we recently worked in a state, which we won't name, where they devised their own risk assessment many years ago. And when we went in, we found that their risk assessment classified 76% of people as high risk. Surprising. But only 28% of those high-risk people they said were high risk were recidivating. If 76% of the population is serving as high risk, something's wrong. And so we reclassified, revalidated, and changed the way they were scoring the risk assessment and brought it down to 39% is their high-risk group now. And guess what? The recidivism rate for that group actually is now higher because we're better identifying those individuals that actually are recidivating. As a result, they can focus resources, use less probation parole officer time, use fewer resources in the community to target those individuals. The third point is that ensuring your approach has a solid research base and is of high quality. So you've got your target population defined by geography, you're focusing on high-risk individuals. Now you got to do something with those high-risk individuals that we know or we think might work, right? We know a lot more about what works. There's been a lot of meta-analyses done recently. This one's from Steve Ose and Washington State Institute for Public Policy, which identifies a number of programs that have demonstrated reductions in recidivism over the years. We know drug treatment in the community is twice as likely to have an impact in recidivism than drug treatment provided in prison. We know that cognitive behavioral treatment programs work for general population of offenders, which should be a part of most reentry efforts. But the key finding, the intervention that has the biggest impact is what's described here as intensive supervision treatment-oriented program, which is basically what we're talking about when we talk about evidence-based practices. Focus on high-risk individuals, identifying those criminogenic needs that are most likely to be tied to their rates of recidivism, and balancing supervision and treatment, right? So that parole officers not simply just responding to negative behavior with sanctions, but also with incentives and with opportunities to connect people to effective programs. While the model you use has to be research-based or should be research-based, should be something we think works, you also have to deliver it in a high-quality way, right? A program isn't a program isn't a program. People matter, and how it's delivered matters. And we know from research in Ohio, it's a very Ohio-centric presentation, I realize, but they have great research, that there's been tools developed, like the Correctional Program Checklist or the Correctional Program Assessment Inventory, the CPAI, that can be done on your program in one day. It costs about $8,000 to $10,000 to have a researcher come in and do it, and can tell you how you stack up to similar correctional programs across the country. Are you poor, fair, good, or excellent in terms of the things that you're doing and how you deliver that program and what that means in terms of your likelihood of reducing recidivism? Pretty good investment, $8,000 to $10,000. Tells you where you can improve, tells you what you can do to get better outcomes. But what we found in Ohio when they studied all the various programs they were funding is that those that ranked poor actually were increasing recidivism by 15%. That represented 14% of all the programs that the state was funding. 56% of the programs they funded were rated fair and had a 2% decrease in recidivism, basically zero. But then again, excellent, high-quality programs, as they were rated on this scale, had a 16%, 12 to 16% decrease in recidivism. This is significant, right? And so what the state is doing after years of funding all these programs, because they didn't have this information, is now starting to cut funding for those that are poor or fair and put money into expanding those that are good or excellent. Fourth point, last lesson learned, is to establish a regular tracking system. So while obviously, and Nancy and other researchers are masters of being able to explain in ways I will never be able to, the importance and how you actually go about doing a 3-year follow-up recidivism study that meets tests and can be published in journals. But you can't wait 3 years, right, for your results to know if what you're doing is working. And so in the meantime, one strategy is to just establish a tracking system with your Department of Corrections. Simply ask for those parole revocations that are your target population, or whatever your target population is, for a monthly admissions report. Every month, just have them send you an email or a report that tells you how many statewide people came into prison for a parole revocation. And have them tell you what the monthly average was for last year while you're at it, so you know if it's up or down. If you're focusing on a particular county, have them tell you for that county how many people came into prison from your particular county for a parole revocation that month. And again, what was the average for that county over the last year? Question? That'll be available on the website. No. So this is information that every Department of Corrections should have, most have, and most have someone who could get this data to you. I say that knowing, having worked in Department of Corrections where those research staff have been laid off in recent years. Can I use your name? No. But again, this takes time for a department to set up. But I think this is more than anything else you could talk about doing in terms of data collection and performance reporting. This is going to be the easiest thing to do. This is the absolute bare minimum And this is data, again, that more so than how many people completed drug treatment or how many people needed X, Y, or Z service or risk assessment, that stuff, difficult. This should be fairly within the reach of any Department of Corrections to produce and to regularly report on a monthly basis. So with that said, I hesitate going forward, but if you can get that county level analysis, ideally then you can get a program analysis. You could send your list of people that you're serving in your program, or if you're serving, for instance, every high-risk person in that county, which would be a great program and a great kind of target population, you could cut it that way. And if you're working in a Department of Corrections or you're working in parole or probation, what we see a lot of departments doing that are being effective at reducing recidivism, this is true in Kansas, and we're doing this in New Hampshire now, is to have this data on revocations being reported by caseload. First by district office maybe, but then by caseload, so that if you're managing a group of parole officers and you're trying to reduce recidivism, you know on a monthly basis how each of the parole agents is faring in terms of their reduction. This is the same strategy that New York City Police use with CompStat, right? Your job is to reduce recidivism. We want to do it not by ignoring behavior, but by reducing risk. And I'm going to hold you accountable each month. What happened? I saw your revocation spike. What caused that? What can we do differently to reduce revocations? It's important if your populations are changing or if your program's just ramping up, that you do this as a rate relative to the population you're serving so that you take into account the fact that these populations are going to change over time. So here's an example in Kansas. Kansas Secretary of Corrections Roger Werholtz started tracking monthly revocations back in, I think, 2003 or 2004. Did a number of things over the last 5 years to reduce revocations, from retraining parole agents to putting more resources in the community to doing a risk assessment. Every month he would get a report with the number of revocations. And as a result of what he saw in each month's report, he would hold meetings and hold people accountable. And guess what? Revocations dropped 46%. New offenses committed by people on parole dropped 40%. These are the kind of outcomes you want. But it's only going to be possible if you're tracking in real time the difference that your programs and efforts are making on revocations going forward. Arizona, a similar example. This is at the state level. The state policymakers are tracking revocations on a yearly basis from each county and giving incentives to counties that reduce revocations significantly. Within the first year, we already saw double-digit declines in revocations, both to prison and jail, and $17.8 million in estimated savings to the state prison from reduced probation revocations. That's why we should use data and some lessons we've learned from our efforts. Just quickly on justice reinvestment, it's an approach we're using, which is a comprehensive data-driven approach to reduce spending on corrections at the state level and then reinvest in strategies that can increase public safety in particular communities. Funded by the Department of Justice and the Pew Center on the states, as well as each state we work in contributes to the cost. Key to this approach is that state leaders have to be on board. There has to be a commitment that's bipartisan, interbranch, and bicameral, and there has to be a work group set up that we can work with to forge a consensus among those state leaders about what path to follow. We do 3 phases to the process. First, we analyze data from across the system. This is where we come in and take all the data and leave, and then come back and tell you what it says. We develop policy options. We look at all parts of the criminal justice system, not just parole or reentry issues, but also look at crime and arrest and conviction rates. And we do some mapping of prison admissions and social services to show the often mismatch that we often see there. And then we develop policy options that are practical, pragmatic, and can actually result in both short-term, medium-term, intermediate-term, and long-term cost savings to states. Second phase is about implementing those policies, right? You can do a lot of things in policy, but if you're not focused on how to implement those things effectively and changing organizations so that they have the tools and training to translate those policies into effective practices, it's not going to be successful. And you have to deploy those reinvestment strategies in programs that are going to be of high quality, as we were talking about before. And then finally, you need that tracking mechanisms that we were talking about on parole for the entire system, right? This is an interdependent criminal justice system. You can't just look at one part of the system and focus and expect results. Things are going to start happening in other parts of the system that you're not looking at that are going to be either counterproductive or costing other parts of the system a lot of money. So we've worked in 13 states, or currently working in a number of states as well, applying this strategy. And in 10 of these states, policymakers have taken these ideas and actually implemented them and actually realized significant cost savings. Texas realizing $450 million in cost savings over a 2-year period. Kansas averted about $500 million worth of prison growth and construction that they were slated to do in 2007 as a result of pursuing these kind of strategies. Just to quickly focus on New Hampshire, where we just finished working on phase 1, this is the kind of mapping that we do of the entire criminal justice system. This is a hard to read, complicated kind of looking graph, but it's actually pretty simple. We're just looking at the flow of the criminal justice system from crime to arrest to courts to admissions to prison, the probation system and how it's functioning, and the parole system and how it's functioning. And the key thing we pointed out here is while crime has been stable and no one has been coming to prison for a new crime over the last decade, the prison population has increased 31%, right? So it's not because of a crime spike, it's not because we're sending more people to prison for any types of crimes. It's solely because of parole revocations have gone up 50% during this time period. It's a reentry problem, in other words, right? Prison populations increased 31%. Spending on corrections doubled in New Hampshire from 52 million to 104 million. And when we looked at the admissions population, those 3 types of admissions that we were talking about before, we found that parole revocations increased from 35 to 43% of all admissions. They're the only thing driving the population. And they account for about $13 million spent each year by New Hampshire. I'm going to slide through these really quickly because there are other issues we identified just to get to the policy framework. We did 6 policies in New Hampshire that the legislature just put into law and the governor is about to sign. First was to focus supervision on high-risk offenders. There wasn't much difference in terms of how probation and parole supervised a high-risk offender versus the low-risk offender, and they were complaining about high caseloads. So what this legislation does is limit the amount of time that probation officers can spend with low-risk offenders to only 9, 12, or 18 months, depending on their crime. And after that point, they go to administrative supervision. They're not supervised actively, and that time is freed up to spend on high-risk cases, which will be continued to be supervised. Employed short, swift, and certain jail sanctions. Basically allowed judges to include as part of the sentence a short jail sanction to respond to minor violations. We found that a number of people were coming back to jail awaiting probation violations, and they were put back on probation because it was a minor violation. And so this would actually reduce the amount of jail time used. We established intermediate sanction programs to respond to minor parole revocations and designated a particular parole revocation facility. We also, the biggest savings that came from this proposal was putting a cap on the amount of time that someone can go back to prison for a parole revocation. They were spending about 9 months on average, and the new legislation caps that at 90 days. So every person that comes back to prison for parole revocation now is going to spend 6 months less time and immediately save the state about $15,000. We reinvested in treatment for high-risk and high-need probationers and parolees. We identified the behavioral health treatment needs, mental health, substance abuse, co-occurring issues, and came up with an actual plan, given the high-risk population, given those in the high-risk population that actually had high levels of need for treatment. It was actually only about $2 million the state needed to fund all that treatment when you actually did the analysis and identify the high-risk population. Ensuring that everyone leaving prison has 9 months supervision. A bunch of people were being released without any supervision to follow because they'd maxed out the entire sentence. This required people to be released 9 months prior to that max date so that everyone had a period of transition. And then we required nonviolent offenders to serve only 100 to 120% of their sentence. Offenders were being held in prison longer to 150, 160% of their sentence because they didn't have housing and because they didn't have a job. The state was paying about $20 million a year because people paying for housing in prison because they didn't have housing in the community. Our point was, you're paying for housing, it's just really expensive housing. If you want to fund housing, then fund it in the community, but don't waste resources holding people in prison until that point. As a result of these policies, it's going to reduce their prison population by about 20% in 5 years. No retroactive application, no early releases, no mass releases as a result of these policies, and save them about $20 million over that time period. So that'll end. I'll turn it over to Nancy, and we'll talk in more detail about using data.